Hello and welcome again. In this video, we're going to discuss about another skill which is really important when you're doing your day-to-day dentistry or full mouth reconstruction, which is communication skill. Communication skill is very underrated, although everyone knows that it's really important to communicate very well with your patients. It's very difficult to execute it at a high standard. I'm also learning, and you learn from your experiences. However, I would strongly advise you to do communication courses, to make as much effort as you can in improving your communication skills, because once you start doing bigger cases, the only way you will land yourself into trouble is by lack of communication. If you have communicated very well with your patients or every aspect of the dentistry you're going to do for them, I'm sure that if there's any issues, patient would be understanding of it, because at the end of the day, dentists are also human beings, and we cannot have 100% of the success 100% of the time. But it's the communication skill which usually lets us down. So as we know, communication is such a big topic. I want to pick two things which I would want you to improve when you're doing communication with patient. Let's look at this case. So if patient such as this comes to your practice, what goes in your mind? Many times when we look at patients such as these or this type of patient, we think that patient hasn't taken care of their teeth, they possibly can't afford that treatment, patient in not a right state of so that they can take care of their teeth, and they don't have time or whatever reason. Many times we can be judgmental when we are looking at the patient. If patient such as this comes to your door, you may think that this patient is very well looked after, the patient cares about their teeth, but it's the same patient which you saw in this slide, and this patient came to me and we did a full mouth reconstruction for the patient, and this is the result. So the first tip is, make sure you do not judge patient. You do not judge patient whether they have money or not. Our job is to look in their mouth and then give them the best advice possible for them. And irrespective of their status, irrespective of their history, what they've done before to their teeth, we need to make sure we do not judge our patients and make sure that we give them whatever the best advice at that time for that patient, and let the patient decide whether they want to do something about their teeth or not, because many times circumstances changes, and patient may not have time before or may not have money before, and patient may now be able to afford the treatment and just embarrassed to ask for help or frightened because of their previous experience. Whenever you see this patient, make sure again you don't portray that judgment onto the patient that, oh, why you're not taking care of that your teeth, why you left it so long. And there's always a reason why they haven't been to dentist or why they've left it too long, and it's not our position to judge patient. We need to give them our right advice. Of course, if we feel that patient cooperation is lacking, then first we need to start with a smaller treatment. We need to start with oral hygiene instructions, clean their teeth, make sure that they're looking after their teeth before you start doing full mouth reconstruction. Because when you start doing full mouth reconstruction, and if patient's not looking after their teeth, then you are as responsible for the treatment as patient itself, or himself or herself. So make sure that you, of course, do your due diligences, but do not judge patient and give that patient a chance to improve on their oral health. So the first tip is, make sure you don't judge patient. And the second tip is, be consistent. Make sure that you take photographs, make sure you communicate with patient exactly the same way as you do every time. For you and for your nurse, many times it's the same show again and again and again. However, when you are for that patient, it's the first time they are doing this treatment and they're seeing you. So make sure you put on that show, make sure you do your due diligence, make sure you do your proper examination, photographs every single time when you see any patient, even if you've seen patient for a checkup before. And there are three factors which can affect your consistency. One of them is depending on the mood. I've seen that many dentists, nurses, and receptionists, all of us are human beings, and we are all affected by mood. And if you're not in a good mood, it's not patient's fault. So make sure that you communicate with patient as if you're in a fantastic mood, and you need to convey this to your staff and to your receptionist that patients, when they come to see you, it's not their fault that something going on in your life, unfortunately. You need to make sure you give your patient 100% of the attention. Outcome of the previous patient. So many times what happens is that patients seeing you regularly, they come in 6-monthly checkup, and we all have this patient where you had a check with patient that your teeth are wearing down, you need some more treatment, you have a caries in this tooth, or you have periapical lesion in this tooth, but patient says, look, you know what, it's not hurting me, I don't have any issues, I don't want anything done. And when you discuss with them once, sometimes discuss with them twice for their next checkup, and patients keep saying no, and then when patient comes to you third time for a checkup, you might think that I don't want to have a chat with them. I've looked at the notes, I've told them last 2 times that they need this treatment, and they refuse the treatment, so what's the point in having a discussion? However, as we discussed before, the circumstances may change, and your job is to look at that patient with a fresh eye every single time patient comes. And many times when you look at the previous notes, and that's why I intentionally sometimes ignore looking at my previous notes until I've done the assessment of the patient, because I don't want to judge the patient from my previous notes or the notes for other dentists, because if maybe other dentists, or I've written down that I'm watching this tooth, patient doesn't want any treatment, I am likely to not then recommend anything to patients. So I make sure that I see every single patient as a new exam patient and do all my assessment as if I'm seeing that patient for the first time, and that gets me away from being complacent. And that brings us to the last point, which is being complacent. You take photographs in and out, and you sometimes think, I don't want to take photographs this time. I'm tired, I'm running late, I'm doing all this time. Patients saying yes anyway to the treatment, whether I take photographs or no, because I'm very good at talking to patient. And many times we get complacent and we stop taking photographs or communicating as well as we did once before. And complacency is a killer in any part of dentistry or anything. When you start doing, let's say, implants, and when you initially start doing implants, you're very careful, you plan really well, you place the implant, and then when you feel like when you've done 1,000 implants for a single implant, it's nothing, it's easy for you. And it's very easy to be complacent and not plan as meticulously as you once did before. So make sure that you treat every case as if your first case, and make sure you don't be complacent. So I hope you enjoyed these 2 tips. And as I said, please keep improving your communication skills. I do improve my communication skills all the time, because we're never perfect. As they say, we are all practicing.